So having adjusted the field size and the weightings, the last thing we're going to have a look at to optimize the plan is to add some wedges to modify the beam profile. And if we look in the three views, particularly the sagittal and the axial, we can see we've got a dose gradient across the PTV. So although we're within our 95 to 107 for the vast majority of the PTV, other than this area up here, we can see here that we've got a dose gradient going from hot to cold, so more than 105 down to less than 95, and in that kind of general direction. And if we look on screen here again, we can see in the axial that we've got this hot region here and it gets cooler across here. And what we can do to just emphasize that, I can just put a beam profile across that region there, and you can see here that the total, what we would really want is that to be flat across there and then to drop off again. And we can see that we've got hot in this region here and then cool in this region here. So and we might expect that. So we've talked about in the past in terms of using wedges to counteract the patient shape. So we often need wedges on our laterals. So the reason we need it on our laterals is because that's the direction that we want to move the dose in. So as I've said before, the easiest way to think about a wedge is like an arrow. So the thick end being the bottom of the arrow, and then the thin end being the point of an arrow. And the direction it points in is the direction it pushes dose. So we want an arrow pointing from here down to here. And so the way we're going to do that is by add a wedge laterally from thick end here, thin end there. Okay, so the reason we don't want it on an ant, because if we added a thick end here and a thin end there, that would push dose in that direction from left to right, so it would increase the dose on this side and decrease the dose on that side. But what we want to do is decrease the dose anterior and increase it posterior. Okay, so what we're going to do is select a left or a right field. So we'll go for left, and then the wedges come under this accessories tab. So if we click on accessories, we can see that we've got a number of wedges. So as we're on a varying machine, we've got electronic dynamic wedges, and we've got a number of options ranging from 10 degrees, 15, 20, 25, 30, 45, 60. So the bigger that number, the more effective that wedge is. Okay, and in terms of the in and the out, that talks around the jaw in which is going to move in order to cause the wedge profile. So by changing it from in to out, we're essentially flipping the wedge by 180 degrees, and we'll have a chat about that in class. So as everything we've done so far, it's an iterative process. So we're going to pick a wedge, see if it works, and if it doesn't, then we're going to change it. Okay, so again, I'm not necessarily going to optimize this fully, I'm just going to demonstrate how it works. So I'm going to pick a 45-degree wedge to start off with, and then I'm going to click OK. So what we've said is we want a wedge with the thick end there and the thin end inferior, and we can see that that's not happened. So if we change views, we can see that we've got a wedge with the thick end superior and the thin end inferior. So it's going to push dose in this direction, which isn't what we want. So what we need to do is to move the wedge by 90 degrees, and the way we do that is by moving the collimators. So if we move the collimators to 90 and then click OK, we can now see that the wedge is going from sup to inf. So let's make that bigger. Not sup to inf, sorry, ant to post. So that's the direction that we want it in. And similarly, if we look on this other window, we can see again we're going from ant to inf. Sorry, ant to post. The problem we've got now is though, because we've rotated the collimators round, it's kept the same field size, so our field size is now wrong. Okay, so if we were to do this in clinical practice and you were to do this for a living, then you would know to set our collimators to 90 or 270 for a lateral at the beginning. We've not done that because I want to show you the process by which we need to do that. So once again, because it's the wrong way round, we're going to reconform our MLC. So on the left field, I'm going to do that, and I'm going to once again put a 0.5 margin around, and what we would then have to do is optimize them again from what we'd done in the past. Okay, so that's that one. We're then going to do the same on the right. So I'm going to change the right to 90 degrees. Once again, the field size is now wrong, so I'm going to set that back to 0.5. And if you've got a leaf selected like that, it comes up with an error, which is quite a common thing. So just click away, so it deselects it, and then let's do that again. And now it does it as we should. Okay, so we've now set that round. I'm going to pop a wedge on. So properties, oops, sorry, go to the field, properties, accessories, and we tend to keep the wedges the same angle. Okay, so if we look across on here, we can see that I've changed that to 90 as well. So on one side we had an out, on the other side we'll need an in. And if we click OK, we can see that that's in the right direction. If we just change the col to 270, so the cols are opposing, then we would have them both as an out. So one of them needs to be different. So now we have the wedges in the right direction. We would then recalculate again, and let's see what that does. So we can see that that's removed that hot spot and even the dose distributed out now. So what we can see now though is we've got these hot regions underneath the wedge, which is quite common. So we're now back to having more than 80%, and we can see we've now got a dose gradient in this direction. So it's not as bad as it was before, but we've got all the 100 plus, so 104 posterior and less anterior, and so the combination of that and that tells me that the wedge that we've put on is too big. So what I would go back and do now is reduce the wedge and then recalculate once again. And so in order to optimize this plan to being a clinically acceptable plan, we now would need to adjust the wedges and weightings would be the key to balancing this out to get a homogeneous dose distribution across the PTV, and then get rid of these high doses in this region here and this region here. So to do that, it's a combination of maybe putting more through the anterior and adjusting the wedges in order to do that.